And yet somehow we're still not healthy. My goal is to provide relief, but also slow things down to explain. But the
It
patient
just
is
it,
the one responsible, but
yeah.
they'll make those things.
We're led to believe by certain areas of our political parties that what you have over there is what everybody loves, which is not what you're talking about, your way of doing it. It's the old-fashioned way of it works, it's efficient, it's business, we need that here because this is not working. And actually, it's refreshing to see you're sort of almost bringing into American healthcare what we are sort of slightly losing, the personal thing. It's all targets and budgets. I mean, just for example, I have a hernia caused by the prostatectomy to remove prostate. Sometimes it's a common thing for some men just because of the way that they go into the body to take it. Now, we have a postcode lottery thing here where if you're in a certain region, you're just going to be unlucky and you're not going to get certain treatments. But it all comes down to budget. And because of the budget, then I have to wait till it becomes life-threatening rather than just short-term, quick hit, fix it, mesh it, send them out, spend a couple of thousand or 6 or whatever, or spend 30,000 plus because it's an emergency operation. So we've sort of moving towards transactional sort of, right, how much is it going to cost us to treat people, despite the fact that we all objectively want to live better quality of life, healthier lives. The systems still, despite your efforts and the greats, still look at healthcare as almost, can we afford that and shall we give that this because that's going to take money from this, quarterly recording and quarterly report. So just bearing that in mind, a lot of support systems in healthcare do feel transactional, we just mentioned, and not just over there and here as well. So diagnosis to cure, basically. How does your view of a support network differ from what most patients experience?
So I think they're getting somebody to hear them. I think a lot. I think let me go back this way. Say this way. There's a lot. Sometimes it feels like there's a lot of services available to people. There's a lot of different, like from not-for-profits to that in healthcare that's trying to. There's also social determinants of health. Kind of like that affects sometimes healthcare, like transportation, like the food, like access to transportation, reliable, right? Access to food, access to pay your rent, ability to pay rent and food, or to have a food available where you live and what you could afford, right? And so forth. There are areas, and it feels like there's a lot of source available to help people to navigate some of those things. And yet somehow we're still not healthy and we're still not people not hearing correctly, or still there's a lot of transactional continues to be feels like very transactional. And so I think part of support system is kind of like slowing things down. That's my goal, is to provide relief, but also slow things down to explain. Because I think because someone, let's say if I work because we have what's called health home, right? We have this health home program. Based Medicaid for people who are vulnerable, or maybe a disability, also on a low income, individuals with high needs for health, and it could be mental health, some use, and then health related issues.
Yeah.
The goal is to have a case manager follow up with those individuals and help them to navigate healthcare, ensure that they make better decisions about their health and access. But sometimes in those situations happens that you have sometimes 50 to 60 in the caseload, you have 50 to 60 people per case manager.
Right.
And a lot of times it becomes very transactional. Phone calls say, hey, how you doing? Have you been to the doctor? Everything is good. Okay. And then move on. And sometimes there may be like, they experiencing they can't pay their rent, so they're in the housing court. And so I'm helping them to navigate that and apply for rent assistance, right? But again, it feels sometimes, because I have 60 people, I have to break it down. And again, it feels like you only there because you've been paid for, and I still don't feel supported, or I feel like I try to call and I don't find answers.
Yes.
And so that's a part of it. So it feels like sometimes there's a lot of areas where, and everybody works in silos. There's not much. And then sometimes it feels like the person could have 5 different case managers from health insurance, but they only do X, Y, Z. They only do, they call and say, hey, you have you need let's say a shower chair. all right, get your doctor to fax to this number prescription, and I go. And then once I receive that, I'll walk through our department to make sure that they get approved. But it's not the case manager who's going to call the doctor. Still, the patient still has to call the doctor.
Yeah.
And
there's no crossover, is there, from the silos?
No, they're not. The patient is the one responsible.
Yeah.
But they'll make those things, right? So even if you could have a health home case manager, you could have an insurance case manager, but yet you still, as a patient, a person still has to do that. So part of what I'm trying to put it out there and say, no, I'll take over that. I'll make sure that signs the consent forms to make sure I'm able to share information, and then the doctor can share information. I'll take that spot on, and that's what support looks like, right? That's what it does, is to help eliminate some of those providers in a way, and to say to them, no, let's make sure that we connect the dots for the person. And then the other part of it, to empower the person to be sometimes a sounding board. Sometimes it's not a coordination aspect. Sometimes it's just being a sounding board. Somebody could say, you know what, I don't know what to say. I don't know what to do. This is a problem. And sometimes listening and spend time listening to the person.
Yeah.
We'll and then come up with solutions together or next steps together. And then the person feels validated, and then feels like, okay, now somebody heard it. I'm not crazy. And now I know what my next steps are. And sometimes the person will take themselves. Sometimes it will take on. But that's a support, right? Unconditional support, where we're able to spend. We not chase. We giving time back. We spend time with them, and we hearing them. And because that's the number one thing that is not happening anywhere, is that everybody's time seems to be luxury, and everyone is.
It is so true.
And then you're told, if you're a case manager in a company, to say you can't spend an hour with a person. You have to only do 30 minutes because you have 25 other clients that you have to take care of it. They penalize you if you're spending too much time.
Yeah.
And some things is just not possible to resolve or address in a short period of time that they're allowing you to. So taking that, putting that and say, you know what, time is not a problem. And then just where you at, let's figure out where you at first. And if it takes 2 hours, just sit down with someone and listen. Because after that, they realize, okay, so I'm now in a better position. Now I'm clear. And now the next time you meet that person, it will maybe shorter visits, but because they had a clarity initially. And that's what we don't have. That's what we feel like we're not allowing ourselves to do so. And I feel like that's where support system comes in, is because what we do is we want people to say, you know what, let's put aside the time. Let's figure out what is it you need. What do you need? What are you currently experiencing, feeling? And that's part of what makes us human beings, right? That's ability to relate to one another and just sit and talk it through. That's who we are.
It's a very you're looking at you've got a long-term position, so you're not just looking here. You're looking
right, but it's not just that, because we are human beings look long, right? Even if I met with you, let's say I spent with you 2 hours, and that's it. We don't have any more conversation after that, right? That's only what it took. But then you have a better position for yourself to say, you know what? Now I have more clarity about my problem. Now I know what to do. I may call back in 2 months later and say, hey, this is what happened, or I have a new problem, But longevity is what makes us,
It is. But we live in a very short-sighted world at the moment, which makes for great sort of social media owners with your algorithms and your 3-second hooks and all of those things. And it's very much, this has been around, this isn't a modern thing. I worked many years ago, probably over 10 years ago, for a government run system. It's still available. It's called legal aid, basically. And basically, if you qualified because of income levels or benefits, welfare benefits, you got legal aid for things like repossession of property or possession of rented and other issues. And they basically said, right, okay, well, we have free reign, basically, as the runners of those contracts in the charities that I work for, I think called Citizens Advice Bureau. I don't know if you've ever heard of it. It's well known, been around since Second World War ended. So it's longevity and it's run very well. But the government meddled and said, right, well, we don't really want you just going, well, we'll just take as long as we need to take to get the problem fixed, because if we don't, they'll have to come back again and then we'll have another call, another letter, another meeting. It just drags out the problem even longer than it needs to be. We'll just take 2 hours, like you said, sit down, get to know the person, find out everything that's going on, and we can hit it in a wunner. And they went, no, you've got to do it in half an hour. Got to be half an hour. No more than that, you won't get paid. So then basically, to keep getting paid, the Bureau had to change against its own better judgment. And it almost then became transactional. It was almost, right, okay, well, we're getting to 25 minutes and I'm going to have to finish this. And as I said at the beginning, when you start to put statistics, KPIs, I hate KPIs. They drive me insane, the KPIs. KPIs on a person's head when it's directly affecting their physical or mental health, whether it be a general practitioner in the UK, they get 3 minutes per person now on a morning when they do their surgery. In big cities, 3 minutes. That person's probably waited 6 months to pluck up the courage and maybe a month to get the appointment. And they've probably got multiple issues, but they're not allowed to talk about multiple issues because the government said no. So then they have to go back with one dealt with, 3 minutes, get through it, and then they're out. And then they have to make another appointment to come back and talk about the other 5 health issues because the system is transactional. It's almost like, right, well, I'm sorry, but that's the value for money that you get. You pay that amount, you get that. So I think there's a lot of correlations, isn't there, between America and the UK, and what you're doing is, as I say, something that we tend to be wanting to get rid of. And I don't think the people of this country want rid of it. I think the runners of the country want rid of it because they don't want to waste what they think is wasted money. So you can't just go, right, we'll only deal with the next day worth of problems, because then, like you said, it just gets worse. Just sit down and take the opportunity and the time, do it now, first time hit, and everybody gets an outcome pretty quickly, don't they?
Right. But I think
that's good. Sorry.
No, go ahead.
No, I think that's good advocacy work, isn't it?
It is. That's what the purpose of advocacy really is. But as a part of this too, if you start asking people, who do you vote for? And what are you looking in the person who's voting for? Because if those questions are being asked, then we're responsible. We're kind of voting for people that are actually making those decisions on our behalf. If we ask those questions, then maybe we would have picked the different people that represent us in the government. Because at the end, if that's what matters, that will be a conversation about that, right? And I feel like that's what sometimes needs to happen too. We need to slow down. One thing we have to realize, we at a speed that it's crazy. Like we are feels like we're in a speed of, we go 100 miles per hour. And we don't find ourselves stopping ourselves. One thing about COVID happened, when the COVID happened, everybody stayed home. So everybody stopped what they were doing, chasing whatever it is. And took a big breath. Even our Earth took a big breath, right? Because when people stay home, no, there's no flies, nothing. We've heard stories where whales coming back, right? Areas that they weren't seen before, right? And then like birds are coming in, flying in, and then some people, there's a bird. All those things also have like, oh my goodness, there's a beauty of that, right? So I think we need to take a breath. And I feel like if we realize who's making decisions, why they making decisions, and do we have a power? And we do have power only if we find people and also start asking those questions, because then we start asking our neighbors and our neighbors start asking them. And they start saying, okay, we should really take a look at that, right? So I think reclaiming that power is what we need to do.
We do.
But the point, like, the other part, just to kind of piggyback, you said, like, it's because when the government says you only have 30 minutes and that's what we pay for, fine, I'll take the 30 minutes and I get paid for that. But I'll take another 15, 20 minutes. And yes, I'm dividing, let's say, if I'm getting paid $50, if I'm an hour, it's going to be $25. Well, you know what? That's a decision. I'll take an hour, bill for 30 minutes, but I'll take an hour, get things done what needs to be done. And so the person feels still heard and supported and move forward. So I'm taking cut back. Because again, it goes back to, the question is how much money, in a profit or not for profit. And what does it mean? If I could make $5, then I make $5 extra. If I don't make it, then it is on me to figure out how to move forward. And maybe the next person does not take 30 minutes and takes only 15 minutes, but you still do for 30, right?
Yes. Yes, yes.
That's where you find that. Well, that's where you find that final ways that flexibility,
Yes.
because not every person is gonna. You can treat every person the same.
No, you can't.
So, and so that's the thing I'm saying. Like sometimes you have to take the whole look at the bigger picture and say, okay, how many people take this longer? How many people is going to take less? And I'm still balanced. I'm still going to do it for the same time amount of time. That's what I'm
It
allowed.
is.
I'll do that, but I don't. But I would not let the person know that's how long it takes. And sometimes you could reassess your intake, right?
Yeah.
Questions you're asking, so you can get to the same place. Sometimes you still need a hold hand, right?
Yes.
It's still provide a hug, a hold hand, or just a space for a person to feel like just slow down, we'll be okay.
Yes.
And I think
Well,
that's us. That's
yes.
still on us. No matter what decision makers are, we could make and figure out design service based off that.
It is. And do you know, it's, well, I don't work in that industry anymore. I sort of left
Right.
that because it was all contractual work and you never knew when you was going to get a job. But it's really difficult, I think. And I get to this, it happens in the NHS as well, particularly in A&E departments, which are overrun in most major cities. It's just ridiculous. But when you say to yourself as a nurse, we're going to say, if you're a nurse and you're in an A&E and you are probably a nurse because you want to help people. You don't just go into it for the money because they don't get that much neither for what they do. And you think, right, well, I know I'm looking at the waiting room, 300 people waiting, and it's a 24-hour backlog because that's what we've got at the moment in our local hospital, 24 hours to see a doctor at A&E. So I need to just fly through these people because I've got so many times. And these nurses will then be accountable to their nursing manager, which in most cases is clinical. But that nursing manager is not probably going to have a clinical manager above them. And that clinical manager is not bothered about, or she's not bothered about the clinical outcome or the clinical nature of the interaction. They look at the interaction as a KPI. I've got to go to a non-clinical person above me and explain why you didn't get that waiting list down. And then that nurse says, well, I'm not going to do that. I'm going to actually take what it takes. And I guarantee you that nurse in their monthly one-to-one will be up in front of their manager, who's already had their head chewed off by their manager and up the tree it went, and to be told you can't do that anymore, because ultimately I'm going to have to put you on the disciplinary. So although the will is there from people, and we do what we do, I did what I did for many years, and to help people, the powers that be make it extraordinarily difficult. And I was going to ask you a question about what you thought the people of the US find the barrier in, obviously, what you do in advocacy and connections to support. But I want to ask you what you think your greatest barriers are to getting the achievement that you want. Is it the people's, or is it the systems around you? Is it the silos of everything? What is I mean, it might not be stopping it. You might not have any barriers. It might be working smoothly. But if there is, what are those barriers?